So it's very important for the therapist working with cancer patients to know contraindications for exercise, contraindications for manual therapy, contraindications for modalities. So contraindications for exercise would be your normal ones for exercise, but a couple that are in addition. So DVT, PE, are they anticoagulated? Oxygen saturation levels below 90%. And we take a big picture of how the patient's responding during exercise. If they start to drop below 90%, we can start having them doing some breathing exercises and read with that pulse ox and see that percent and have the patient see that percentage increase. And I make that a goal. So during a certain exercise, their levels will not fall below the 90th percentile, or they will take 5 seconds, a minute to return into the 90th percentile, et cetera. So we look at the whole picture of the patient. That doesn't mean that if their O2 sats drop below 90%, you're done, you don't work with that patient anymore. So some of these are relative contraindications and some of them are absolute contraindications. So unstable bone mets, we talked about how we need to find out from surgeons, we need to find out from oncologists, what is the integrity of the bone, when was their last bone density test, bone scan. If greater than 50% of the cortex is involved, they're not weight-bearing exercises. If less than 50%, they're partial weight-bearing. That goes for the upper extremity too. During blood transfusions, that's a relative contraindication. In our hospital system, we walk patients on on blood transfusions. So it depends on your hospital's policies. And again, we're looking at the whole picture of the patient. What signs and symptoms are they reporting to you during that exercise? So an absolute contraindication would be when their platelet levels are below 20,000. They are at risk for internal bleeding, and any manual treatments that you do, any contact can cause severe bruising. Anemia, hemoglobin, when that drops below 8, they need to be reported back to their doctor. But again, we're looking at the whole picture. What has been the trend with their levels? Is the doctor aware of it? How are they responding? What's their pulse ox? What's their blood pressure? Another contraindication would be, relative contraindication would be orthostasis. This is something that we can treat. We can treat with compression. We can treat with a gradual weight-bearing program, an endurance program. But these are things that you need to take in consideration with your cancer patient and exercise. Another relative contraindication with your cancer patients is within 2 hours of having a chemo infusion or within 2 hours of having radiation. And the reasoning behind this in the literature states that you increase circulation with exercise. So we know this. So if you prescribe exercises for them to do in that time frame within 2 hours, you're increasing the dosage and you're affecting that dosage. The doctor needs to be aware of any exercises that you would prescribe within that time frame. Some oncologists say do whatever. But there is literature to support that we can affect the dosage of that treatment by immediately getting them to exercise. My advice is if you do see the patient based on scheduling issues, they had their radiation, which took 5 minutes, and then they're going to come up to your therapy clinic, let's start with something different. We're not going to start with some global, circulation increasing hard exercises. Public gyms and pools, and this depends on if they're in chemotherapy, if they're in radiation, when that chemotherapy reaches their nadir. Their doctors should be talking them to about when they should not be exposed to people that are sick, large groups in public areas. And no pools. Resistance exercises, this is an absolute contraindication. Resistance exercises in a muscle in the area of a portacath or other indwelling catheters. So you do not want to give a resistance exercise to, for example, the pectoralis region where the portacath resides. That can cause some issues with the circulation and could possibly cause some clogging in those catheters.